Hello, everyone. How are you? I'm Angelica. I'm just here for a review for Dr. William Schwartz, Dr. William Miami, as a lot of people know him. I think his name is Karl William Schwartz. I don't know if I'm pronouncing it right, but I'm so sorry if I'm not. I'm so sorry for the future mistakes I probably do while speaking. This is not my first language, so I'm sorry about that. But yes, I just wanted to make a quick review about him. I'm basically talking about my experience. Unfortunately, it was not a good experience. So I'm gonna make this as quick as possible because I hate long videos. And just talking about my experience. I'm so sorry about the noise that you hear in the background. I'm like in vacations right now in a hotel, in a room hotel, but um, let's get it. Okay, so first I wanna let you know that I was living in New York when I decided to do this surgery. This surgery was on March 2021, so I had to travel all the way from New York to Miami to have the surgery with this doctor. I did had a financial plan, like payment plan. I did it for like a year. I could like pay like monthly whatever amount I wished. I found him through a cousin that had a surgery with him previously, way before I decided to have mine. That's why I found him, and that's what I thought it was like a good option. It was affordable for me by then. And honestly, through his social media, everything seemed amazing. Unfortunately, my experience was not good at all. It's been 2 years, and I think every day I regret on like doing it. So yeah, basically, everything started in March 2021. I just want to make clear, like, I never had any type of previous consultation with him. Like, him seeing my case, I had two verse breasts, so I wanted them to get fixed, of course, because it was making me very uncomfortable, very insecure, and I just thought he was gonna be like a good option, honestly. Like seeing all his social media, I knew that he had like previous experience fixing this kind of breast, which is like cone shaped breast with big areolas. You can Google it if you don't know what I'm talking about, but a lot of women I think has it. It's not like uncommon. So I wanted to get them fixed, or I wanted to get them better. I never had any type of pre-consultation with him. The first time I see this doctor was like just like the day of the surgery, like maybe an hour before of the surgery. I want to also make clear like the administration or the staff was like super bad, very disorganized. They made me do like a lot of type of breast tests or exams that I was not supposed to have, such as mammogram or ultrasound, as I know, like because I have like talked to other doctors after the inconvenience that I had with him. I'm not supposed to have it because I was back then just 21 years old. So I think those type of like exams, you're supposed to have them after a certain age. I think it's after 40. So they were very like disorganized and telling me what to do or what not to do. One person would tell me one thing and the other person would tell me another thing. I was young also. I didn't see the red flags. I think everyone should have like a previous consultation with the surgeon that's gonna take care of their body, you know. I wanted something cheap. I wanted something quick. So that was my mistake. That was my mistake number one. So yeah, the day of the consultation did not existed. It was just everything right before the surgery, basically. Sorry, I had to change of room. But let's continue with it. Like I was saying, Um, Number one, did know it there was not a consultation, and like I want to make like a big thing here where I want to like clarify. I know that like doctors here might be different, but I feel like doctors in the US might be different than in like South America. South America doctors are like very, I would say like very good in terms of like making sure that you feel like comfortable, making sure that you feel like they answer all your questions. Like there was not any type of treatment with this doctor. It felt like a meat store where you like get a patient in, then take a patient out, like a bunch of girls just like waiting to be chopped, or I don't know how to explain it, but it was very, very weird, the feeling. And yeah. So I want to go now to point number two. After the surgery, I also did not have like the doctor till the day till 2024. I haven't seen his face. Like he never checked on me. Not right after the surgery. He never like saw my breast. Like he never told me like, okay, it was hard because of this. You had a little bit of problem because of this. Like, how do you feel? I think they look great. He never told me any of that because I never saw him. Like, never. The next day of surgery, I went back to have a checkup, and one of his nurses like saw me, said like everything was fine. They applied nitroglycerin in one of my breasts, which was the left breast, because the areola was like having a little bit of supply of blood, and you're supposed to have a lot of blood like going through the tissue or the parties. I'm not like an expert, but you are supposed to have like blood going on around, so it has oxygen, so the tissue does not die. So I got his nurse, and she sent me back home. I felt like a little bit weird after she applied the nitroglycerin. She explained me it was a very strong medicine, like a strong cream lotion. It was kind of like a lotion presentation that she applied in my areola, or when I was like cut. I did feel like a lot of headache that night, but nothing like too crazy. She told me to go the next day. So I went the next day, and this time another person sees me, does not see me, the same nurse. This time I believe, and I strongly think that it wasn't a nurse who actually saw me. I think there were having like a lot of people there, and they were like kind of like running out of staff that day. And because I was a post-surgery patient, I guess one of the front desk girl saw me, and I guess one of the nurses told her that she needed to apply the nitroglycerin on my areola. The problem, it wasn't that. The problem was that nitroglycerin, like I said, I'm not an expert, but for those who know, is a very, very delicate and a strong cream, which can like be very like risky and very like powerful on people that has like some sort of circulation problem. Thanks God I am young. Thanks God I don't have any type of health condition. But that day she applied way too much in my areola, and you're supposed to apply just a little bit. She applied way too much. Of course, I didn't know you were supposed to just to apply a little bit. She applied a bunch, and I got intoxicated for 12 hours. They were never responsible for it. I felt like I was gonna die. Like I felt like I don't know how to explain it. My head was gonna explode. Like I could feel all the veins on my head like bumping. Like I couldn't even open my eyes. It was the worst experience in my life. So bad. So bad. So yeah, nitroglycerin, please be very careful with that and make sure that if you hear this while having your surgery, please make sure it's a person that is like a health professional. Do not let anyone um, apply it to you if you think this person might not be like a health professional, like I said. So yeah, that's the point number three. There was someone that was not a professional applying very like dangerous creams on my just recent breast. So yeah, let's go to point number four. Just right after the surgery, like I said, never saw the doctor. He never checked on me. I flew back to New York like 2 weeks later, I believe. Yes, like 2 weeks later. They call me, I would say, like 1 month after, 2 months after. I got one of the, how do you say that? Wait a second. Okay, I think it's called stitches. I got infected one of the stitches, and they literally took 3 to 4 days to actually pay attention to me and to send me antibiotics. It was very stressful days because I was in New York. I was very young. I'm still young, I know. But I think you feel very vulnerable when you are like out of your country, when you have no one here to take care of you, when you're like alone in a city, and especially when you don't have like the doctor that took care of you in the same city. So definitely another very bad experience on their side, like the administration, the staff, the nurses, the whatever people is called that was supposed to send me right away an antibiotic once I said like I got one of them like infected. They were not quick. They were not fast. I could leave some of the pictures here of how like now that like looks on my breast. But yeah, it was like very bad. And also, I guess I could say like number five night now, like this is the one that like matters to me the most now. It's been 2 years, and you might like wonder how come you waited 2 years to do this. And basically they always told me that you had to wait at least a year to see the final result. I was not happy with my results since I first like noticed that they were not like changing after the year. When I turned a year, I sent them a photo saying like, hey, like my left breast is way smaller and higher than the left one. They told me, oh, that's the way your breast is like naturally. We cannot do anything about it. Whatever, I just let it be. But in the past year, like on the second year, this year, it's changing more. It's been like changing more and more, like the shape and the texture. Now I have like, how can I say it? Now I have like rippling on my right breast. Now this is like totally way up and tight. This one is totally down, and like I said, with rippling. I have this like scar that I got from the infection that I had from one of the stitches. So it got really like really, really bad in the end. I'm not happy with my experience. I would not recommend anyone to go to this doctor, especially if you're trying to fix something that is like a condition, like a breast condition. If you're trying just to do augmentation and that's it, maybe I would say, okay, that's fine, because I have other friend that did it just augmentation and it was fine. But to me, that it was more than just an augmentation, it was not good. Like, I would say this doctor is just not good to fix like particular cases of like breast. Maybe it worked different for some people, but to me, I'm talking about my experience. I don't want to hurt anyone's feelings here if some of you had a good experience with him, but my experience was not good, neither with the staff or with the doctor, how he did the job done.
But yeah, I guess that's my whole experience. I don't want to make this too long. Please let me know any type of questions that you have, and I'll be happy to answer. And I will do now like I guess I could do like a part 2 of things I would recommend before deciding your plastic surgeon, before doing like a augmentation or like this kind of surgeries. And yes, thank you so much, and I hope you're all safe and take care. Bye.